first thing I would want people to have is basically a bad looking x-ray, that they're bone on bone or something's happened to essentially destroy the joint. So a knee or a hip, basically, or any joint for that matter, there's cartilage that is in between the bones, and it's a kind of a firm substance that that allows for some cushioning and lubrication of the joint so it works smoothly, it doesn't hurt, that sort of thing. So osteoarthritis is a type of condition where that cartilage layer starts to wear away, and eventually it wears away to the point where the bone on one end of the joint is hitting the bone on the other end of the joint. The second thing that we would want to have made sure is covered is that they failed conservative management, that there's been some attempt at non-operative solutions to the problem. When we talk about conservative management for hip and knee arthritis, what we're talking about are medications like anti-inflammatories, NSAIDs such as Aleve or Advil, or other medications like Tylenol or acetaminophen. Personally not a fan of narcotic pain medication for arthritis management. Other very important things to consider are exercise, potentially physical therapy. The stronger your legs are, the better your hip and knee will function. So another form of conservative management I think is worthy of consideration is corticosteroid injections or other type of injection therapy. I think these sorts of injections can give patients considerable relief and certainly nowhere near as invasive as an operation. If those are not working well, then certainly surgery is a consideration. And then the last thing is that the pain or dysfunction is bad enough to justify surgery. So if you come in with bone on bone and you don't hurt, and somebody said you have bone on bone, you need a knee replacement, that's absolutely wrong. You need pain or dysfunction associated with that we can then improve on. And so if a person is having difficulty walking, difficulty sleeping, enjoying daily activities, if their world is like closing down because they're afraid to leave the house because it's just going to hurt too bad, they don't want to travel, things they enjoy doing are just not possible anymore, then those are indications for surgery.